Welcome to another episode of Skytale Insights. Today we discuss the concept of navigating risk, regulation, and accurate information in medical aesthetics and how owners can make better decisions in an age of information overload and in a rapidly evolving subsector. To help us navigate this subject today is Madison Dini, General Counsel of Lynch Regenerative Medicine and partner at Michelman Robinson. Her practice has spanned the representation of medical device companies, pharmaceutical manufacturers, physician practices, and other businesses across the aesthetic industry. Her work focuses on the intersection of corporate affairs, commercial disputes, litigation, business operations, regulatory compliance, and risk management, giving her a unique perspective on the opportunities and challenges facing the industry today. Madison, thank you so much for joining us.
Thanks for having me.
So, Madison, Ted came up to me, this was maybe a month ago, and said, hey, we really ought to talk to Madison. Heard really good things about her panel involving the FDA at Medspa, which was now, a couple of months ago. I hear it was standing room only. Was there anything, give us some highlights there. Was there anything that surprised you or you want to share about whether it's a discussion being had, the questions being asked? I think this was a first, so there was certainly a lot of interest. For those of us not there, could you give us any of your insights or what you got out of that?
Yeah, so it was the first time that the FDA had made an appearance at any aesthetics-focused or related industry conference. And so it was exciting because the FDA before that had not come and participated or really gotten to know our industry on that level. So it was exciting to be able to have a conversation with them on stage, and then to also have so much interest in that subject was really cool. So that's what I think was unique about the FDA being there. What surprised me about, I think, the panel in general was not necessarily the content itself, but the questions being asked by the audience really displayed what I think is obviously a misunderstanding of what the FDA does and what their role in regulating our industry looks like. So I think the questions educated me, honestly, as a lawyer about kind of the misinformation out there and how people don't really have an understanding of how that regulation works.
So let's dig into that. How does that regulation work, or what is the FDA's role? And maybe if you can place it specifically within, when we say our industry for this conversation, it's medical aesthetics. Walk us through that.
So the FDA governs the approval or clearance of drugs, biologics, medical devices, things of that nature. And that's really generally said. But what they don't regulate is the practice of medicine. And so I think the confusion in our particular industry arises because providers, or those who own medical or aesthetics, Medspa type clinics, they assume that there's oversight by the FDA on their day-to-day decision making. When really the FDA's focus is on the promotion, the clearance, the approval, the study of drugs and medical devices. So can there be a place for regulation in a med spa, for example, by the FDA? Yes, of course, but not in the way that I think people believe right now. So it's not, did you make the right decision about treatment or care or the drug or device you chose for a particular patient? They have no place there. Their place is in regulating how you're promoting that or how you are selling it to your patients. And so it's just a different way of looking at it than I think people know. So.
Okay, that's very helpful. So, with that, we mentioned standing room only. Why do you think the session did draw that much attention? What was it?
I think generally speaking, again, you're right, I should say the aesthetics industry. I keep saying our industry, but the aesthetics industry is a segment of healthcare that moves really quickly, and there's a lot of innovation, and there's a lot of new treatments out there, and it evolves at a pace that the FDA can't keep up with. And so on top of that, there's this belief that if there's the FDA seal of approval or clearance, then, it must be okay, it must be safe, I can use it, I should use it. And I think providers like the certainty of having the FDA clearance or approval on treatments because it gives them, a path toward a safer option for a patient. And so I think that when the FDA, clears or approves a device or drug, it sends a signal to a provider that there's safety associated, which is good, right? I mean, we want that, and regulation is good, and there's a place for regulation and oversight, but it's understanding how that works in practice that I think people need to get a better grasp on.
Yeah, and you mentioned just now aesthetics is rapidly evolving. Mm-hmm. And I remember a few years ago when consolidation started happening, some of the buzzwords that folks would use was a little bit of the wild, wild west. Things were just starting to consolidate. Now you have, and I don't know if you define this within the aesthetics umbrella, but if it's not, it's certainly tangential. When I think of aesthetics, it's doing a really nice job absorbing or at least working alongside, what we like to call precision healthcare, anything longevity, wellness, functional medicine. And that is coming even further along and faster than aesthetics overall. So you have these two kind of industries or subsectors that really work well and touch each other, that are growing rapidly. Does it seem to you, we're in other healthcare subsectors, and this one is certainly moving fast. You think about others that we play in, like dental, it's been around forever. So I think people generally have a decent grasp on that. And then you compare it to what we're talking about today. Am I right to say that there seems to be a little bit more confusion or gray in business owners' minds when it does come to what we're talking about here, regulation, compliance? And if so, why is that? And is there anything that I, as a business owner, can do about it to become educated, to make sure I'm checking the right boxes?
Okay, let me try to answer that. I want to answer your question. And I think what you're asking is, why is the focus of our industry, and I guess the divergence of the practice of medicine and aesthetics and the way it's regulated differently situated than other types of healthcare? Is that one of your questions?
Yeah, I mean, it really is. It just seems to be so rapidly evolving that there are a lot of questions around regulation, around compliance, around where do I get the right information, whereas others that are maybe a little bit more, I don't know if stable is the right word, mature. Other subsectors in healthcare that are more mature, I think people generally know, exactly what to do to run their practice correctly. And here there seem to be just increasingly so a number of questions around, and so much of it is state specific, and who can practice, who cannot, who can own, who cannot, so on and so forth. So, I'm curious whether you think of it the same way, and if so, why that is. Is it because regulation is kind of a living, breathing thing that in our industry is starting to evolve a little bit, that some of these whether it's state boards or otherwise, are trying to get a handle on as well? What is it?
So I think one thing about aesthetic medicine that makes it different than other aspects of healthcare is that unlike, a surgery center that has, that only employs surgeons and does one type of surgery, it's very clear, like, here are the confines with which you can operate, right? And sometimes it's cash pay surgery, and you don't even have to involve other federal agencies that govern how you pay for medical services, right? And so it's pretty straightforward. But in aesthetics, with med spas, for example, sometimes it's not even always clear if the service you're providing is the practice of healthcare, right?
Medical,
or like medical practice.
Medicine, yeah.
The practice of medicine is what I meant. So that alone causes confusion, because you can also be selling facials, which don't require as much oversight and governmental regulation as, for example, other types of ablative laser treatments, right? And so you have this ability to sell just a myriad of treatments to patients, some of which are actually the practice of medicine, some of which are just selling retail products that you could buy at, a Sephora. So it's difficult to know, like, when are you crossing the line? And then when you do cross the line, like who can actually provide those services. There's so many different functions of regulation that come into play. And so I think that, and again, it's another area of medicine where you've got mid-level providers sometimes owning businesses, right? And that's not always the case in other areas of medicine where, they're owned by larger hospital corporations, and all of that oversight is done for the providers, so they don't ever have to learn it or understand it. Then they find themselves opening their own business in aesthetics, and all of a sudden they're a business owner, a practitioner, an employer, and it becomes a lot. And there aren't a lot of other practitioners out there, I would say, that know how to do it right. So not as many resources to understand it.
That makes sense. Yeah, I mean, when I think of aesthetic practices today, it's not uncommon for us to work with folks that have, everything from injectables to GLP-1s. Now everyone is wanting to add and understand, things like peptides, hormone replacement therapy. You mentioned retail, skincare, medical grade skincare, so laser devices, energy-based devices. So it's a myriad of things that you can offer. So it sounds like each of those could be potentially regulated or viewed a little bit differently by certain boards. So that's really interesting. Generally speaking, do you find our industry to be becoming, I should say, more regulated over time, or is it simply that people are paying a little bit closer attention to what they ought to be doing because of, certainly some of the news that have come out within our space recently?
I think it's both. I think that I don't want to draw concern over the fact that there's increased scrutiny or a trend of increased regulation. What I'll say by way of example is that when the FDA did come to AmSpa to speak, it was also a huge learning opportunity for them. I mean, they didn't know much about the space until they came and started talking to providers and kind of getting an understanding they were walking around the expo hall, literally learning about the different treatments that are out there because, you and I are in this space and we kind of understand what treatments are being offered and what services are out there. But I even learn new things every day. So imagine being the FDA, never having been to any sort of industry event or conference and, seeing 200 exhibitors and learning all of the different options out there, not knowing kind of the scale of whether or not they're drugs or not, or whether they involve the practice of medicine or not. So they're doing as much learning as I think the consumers are at an even slower pace because they only have so much bandwidth. So that's the backdrop to say that I don't think that there's necessarily a push by the FDA to regulate the space more, but maybe I think they are interested in learning more about it, right? To know that, because they have to figure out whether it's something they can or should even regulate, right? Because not everything needs to be. And I think in traditional medicine, those parameters have already been set, right? So it's a fun time to be in it. I wouldn't be worried about growing scrutiny or growing regulation. I just think the awareness factor right now is at an all-time high, right? Because people want to do things right, and I like that about our industry.
Yeah, it certainly seems to be, and I think as groups become larger, generally speaking, I think that means more eyeballs on them as it goes from a mom and pop, if you will, type of model to now you have some significantly large groups. So I think that's also probably adding to some of this discussion. So you mentioned earlier, when you were defining the FDA, what they do, what they don't do. From a regulatory perspective, if I'm a business owner, how should I think about, like you mentioned, medical boards, you mentioned the FDA, whether there are pharmacy boards, how should I think about that? As an owner, how do I learn about that? What resources? How do I check the boxes to make sure that that I'm doing things correctly? I'm a big fan of delegating, so unless you're a business owner that wants to go through all this, what do I do?
I think number one, I don't know the names of the companies with enough specificity to make a plug for them here, but I know there are compliance groups out there that can at least get you started with general roadmaps about, if I own a med spa in Texas, generally speaking, who governs what, right? Mm-hmm. And so And that's true for starting any business. Like, when does OSHA come into play? When does certain HR policies trigger? Because I employ 5 people, 10 people. But I think at the end of the day, finding both a business partner and a legal partner that can help you navigate and set you up for success is really good. I think it's a lot harder to unravel mistakes than it is to just start clean. And one of the biggest mistakes I see people make is to just hire a generalist that doesn't have any industry expertise, right? So like a healthcare lawyer in general is great, but do they understand how med spas are governed? They understand the scrutiny at which they're governed, or the trends and the enforcement trends out there. Because, again, not every medical clinic is judged the same way. So, and every state is different. Sometimes, like, the localities go so far as to even say some cities are regulated or enforced against differently. So I think finding partners who can actually guide you through it with expertise and experience is key.
Yeah, that makes sense. And you mentioned something we like to mention as well, like whether it's legal or really any other industry. It can be tax, it can be accounting. To me, if I have my magic wand moment, I'm looking for someone who actually works within medical aesthetics, because, every subsector, healthcare is such a broad term. Like, it makes up 19% of our GDP. It's tremendously large. So, you want to make sure that they understand your specific business and the subsector in which it plays. You mentioned earlier some of the information, like, where do you get the information? What are some fun misconceptions that you've heard that you can share with us? Maybe some that are commonly said to maybe calm some of the business owners and what we're hearing out there.
I think the most general I should say misused term that I hear in our space that relates to the legal function in my job is when something is illegal. And the reason that's triggering for me is because it's not that simple, and it's not black and white, which I think non-lawyers think is super frustrating, that they can't just get an easy answer. And I've joked with a lot of people about this before, but the whole, a lawyer responding with "it depends" can be so maddening for a lot of people. But it truly does depend. And so when I see people kind of throwing things out there like, this is illegal, or that's illegal, or this isn't illegal, this is perfectly fine, that always draws a red flag for me, because I'm like, how do you know that would be applicable in every single state? That just like blanket statement of whether something's legal or not. It's not a speed limit. Like, how you treat one patient is going to be different than how you would treat another patient. Who's treating that patient? What are you using? Like, there's so many factors that go into it. The blanket statement of whether something is legal or not in the practice of medicine always surprises me and kind of triggers me. And so, it's just like a medical expert, right? Like, it's a complex area and it's a complex profession. So is the law. There's entire bodies of lawyers out there that all they do all day is dive into the regulations that govern healthcare in general. That's all they do. They're just regulatory experts, and their function is to interpret and write laws, right? But then who carries out those laws? A whole different host of experts, right? So maybe they aren't the best person to go to about risk and translating that risk. But I say that so that people understand that there wouldn't be a whole body of lawyers if it was that black and white and if it was that easy, right? And so that just always comes back to industry expertise and knowing who those experts are in your field.
Okay, that's helpful. So what I heard is a lot of body of lawyers to get to it depends.
So that made us look good.
If
I put a good plug in for lawyers.
So if I am a business owner, what are some good, whether it's industry reports, conferences, resources, what are some good ones that you use to get some accurate, good information and stay on top of what's going on in our industry? And it doesn't have to be only compliance and so forth, but where should I be going?
I'd be going to other business owners of established businesses. I'd be going to business owners or leaders that have been in the space for a long time that have connections and can make referrals for you. I would say I wouldn't really necessarily say one conference over another, but I think that going to a conference a year can keep you up to speed on what's kind of trending in the industry. And then going and meeting people who are involved and have been in the space for a long time. That at least gets you started and connected to people and the people that are in the space, right? So I know I've asked you, Ben, for different referrals to different resources and professionals that are in our space, and I just think that's really the only way you can connect to people who know what they're talking about, right? So I choose kind of the personal connection over the Google route of just trying to find a provider or a professional, but that's me. That's how I do it.
Yeah, we kind of work the same way. Like we have, internally lists of what companies we think do really good work within aesthetics, whether it's lawyers, accountants, EMR systems, whatever it may be. We kind of have a list, and some of it, to use some of your phrasing, some of it depends on the business itself, the person themselves. So yeah, I completely agree with that. Let's go maybe crystal ball it a little bit. So if you're looking, we're talking about fast-growing industry. It's doing a very nice job adopting other service lines within it as well. There's this patient evolution that's also exciting. The patients are getting younger. The patients are asking for more personalized health care and so forth. So from where you're sitting, if I'm a business owner, what trends should I be looking out for over the next, call it 3 to 5 years? What do you see happening? And again, doesn't have to be specifically in compliance and regulatory environments, but that would be helpful as well. But what are you seeing evolving in our space over the next few years?
From a legal perspective?
It can be legal. It can be, like some of the things, even though it's not, for us, we're a finance firm, it would be like the adoption of AI and what we're seeing and how it's changing some of our space, some of the ways that even operationally businesses are connecting with patients and so forth. It can be anything. I'm curious your thoughts as to, you're deep in the space. What are you seeing? What should we be looking out for? And then, yes, I'd love a legal angle as well.
I mean, I wish I could say that I think the legal trend will be, it'll be easier to get information quicker, which I actually think that is probably a positive. My concern, I think, on the legal side is that there is such an ease of access to information that I worry it becomes a reckless tool for relying on kind of the wrong experts. And I mean that to say that like AI is an expert in everything, but is that who you should rely on for such a fast-paced evolving industry full of information, right? Like, should I be going to AI for trying to dissect what laws apply to me as a med spa? I don't know right now. I mean, to an extent, but you still have to be able to interpret what that law means and what that risk means to your business. So I am all about AI and making life easier, and I'm all about the introduction of it into our industry because I think it's coming up with some really cool things. But I also think that I think people just need to enter kind of the next phase in the next 3 to 5 years, understanding that you still have to go old school and go to the experts themselves. I like to think of AI as like my first curbside opinion, and then I go get a real opinion to make sure I'm on the right track. And I think as long as we view it that way, I think the trend of it is going to be really positive. But I just think in whatever the trend comes, I think people, what I'm seeing, are becoming more careful, and they're saying like, wait a minute, let me make sure this is the right thing to do. Let me make sure this is compliant. Let me go further than a curbside opinion. And I think that's where aesthetics was. Like, you'd probably know better from a timing perspective, but maybe 5 to 10 years ago, it was a lot of, I'll just ask my buddy down the street how they opened up their med spa, because there wasn't a lot of regulation, meaning there weren't a lot of resources to tell you how to do it. And so people were more comfortable just asking around and doing it like their neighbor. Now there's almost too much information and it's so overwhelming and confusing. So you actually have to dig in and go to the right experts and be able to rely on them.
Yeah, and you touched on what people used to do, and kind of the way I see it right now is you go back 5 to 10 years, it's such a different industry right now. Back then, consolidation wasn't really happening. There were certainly big groups, but not consolidation in this current phase that we're experiencing today. It would tend to be, maybe you're going 10 plus years out here, but it would tend to be maybe an older female, taking on these services, not really talking about them. Certainly you weren't posting about it on social media, a little bit more secretive. And then you fast forward to, call it 2021, 22. Around that time, what happened was, like you heard about the Zoom effect, the Zoom boom. We were coming out of COVID. There was so much pent-up capital ready to be deployed. And it was starting to become more socially acceptable, if I can use that term. The space was supposed to grow 10 to 12% a year. Investors were interested. And it was such a very fast, almost shock to the industry, I think. And people were calling us like, what is private equity? What does this mean? What does that mean? And there was so much pent-up demand as well because American consumers were saving up so much money during COVID that it just gave this amazing boost to the space. And then around 23 or so, you start reading reports of how many new medical aesthetic practices were popping up because with that tremendous growth, I think people assumed, okay, this will be easy to do. And I think the way we see it now, it's a little bit more measured. Like from a consolidation perspective, I know what we're seeing is a lot more scrutiny around diligence. And that diligence, two things that continuously come up, I'd say the biggest thing is, provider retention. That's very big. If you lose a key provider, that's usually not a good thing for us in the middle of a deal process. And the other one is that question around, hey, is there going to be more regulatory scrutiny because there seem to be more eyeballs in this space? I mean, it's such a popular space. And so you kind of get all these things together as to where we are. And I think the next 3 to 5 years, the other key point is now people are waking up to the fact that, hey, if I run a very professional business, I'm going to be compensated for that very nicely. So it's woken up this professionalization of a medical aesthetic practice or group by founder owners, by entrepreneurs. So any folks that we see who are very entrepreneurial, they're looking at it and they're saying, okay, I'm going to grow to multi-location, and here's how I'm going to do it. There's so much more information in a positive way out there of, hey, these are the things that you should look out for if you are trying to scale, if you are trying to grow. And there are, general playbooks out there on how to do that and how investors are seeing things. So it's such a fascinating time, and I think that'll continue the next 3 to 5 years of people really trying to figure out and unlock, how do I become this very professional, business that's serving patients well, that's more efficient, that's able to be replicated, if you will, whether by me or by, a future partner. I think that'll continue the next 3 to 5 years. And I think we'll continue to see the adoption of what today may be tangential service lines that just work really well together within the aesthetic space. And, certainly would expect to see more consolidation and then everything that comes with that, right?
I think something you said earlier reminded me that I think fast-paced still is recognized today. Like, I think things are still really moving very quickly in our space, like from an innovation perspective and, just driving forward with new consumers being interested in aesthetic medicine, et cetera. Everything's moving really quickly. And now we have the addition of even more information. So an abundance of information at a fast pace And the ability to get information very, very, very easily, to me, is what's creating this standstill and the concern in business owners' minds of like, okay, so it's moving really quickly, so I need to get a quick answer. I have this huge arena to go to for those answers, and there's tons of information out there, and then it's almost like debilitating. You're like, okay, I need it fast, but there's also too much information. And so one of the things that I like to think about from the regulatory side is if you're a business owner and you are in the pursuit of having the most compliant business on the planet, you will fail, because there is so much information out there, and there is so much it's so easy to get fearful about staying compliant and perfectly compliant that if you're just focused on achieving that, you're probably missing the bigger picture, right? Mm-hmm. Like, there's also other risks and other concerns that you should really, invest in fixing, whether it's personnel, like you said, or growing your business to be able to cover any, issues that do arise from a legal perspective. It's so funny because people worry so much about staying compliant on certain regulations that at the end of the day, when I walk them through the violation, it's like a $250 fine or it's a warning letter, right? Mm-hmm. And that's the other side of the misinformation piece, is people not understanding what that means. Like, what does it mean if you're not compliant in this one area governed by this one agency? Or what does it mean if you get a letter saying someone might sue you? So often people will call me and say they've been sued, and when I finally dive into what they mean by that, they just have received a letter saying that they might get sued, and they never do, right? And that's just like a notice letter or whatever function it's serving to start a conversation with their adversary. But again, I think it comes back to the point that there's so much information out there. It's how do we use it and keep up with such a fast pace? And so I try to lead, my clients or whoever I'm working with, the company I'm with, from a very practical perspective of let's not get worried about something that we don't need to worry about. Let's look at what really is going on here and see if it's something that's concerning, something worth spending time and money and effort on. And honestly, it always comes back to just be responsible and put your best foot forward. But don't strive for perfection on the regulatory end, because that's just so difficult to do.
Yeah, I think that's really good advice. Number one, you mentioned the amount of information we have now, and it is such a luxury. I read a few years ago that in a weekend newspaper, you have more information in a weekend newspaper.
What's a newspaper?
Exactly. Than someone at some random village in Europe used to have in their lifetime for 300 years ago. Mm-hmm. So if you think about the evolution that's that fast, and that's just one newspaper, one day, more information than someone had their entire lives 300 years ago. And so when you think about that and you think about what we have at our fingertips today and how quickly we can access the information, how quickly it can analyze documents, whatever it may be, it's so impressive. It's such a luxury, but it's also something, to your point, that can become overwhelming. And so that's one. The second point I like that you made there is what I got out of that is you need to really prioritize what is important, what is key. I don't need to check every single box. If I do, great. But if you're doing that at the expense of something else, that can be dangerous. And I know we've talked about this, but I know the way we like to run our firm is I don't want to know everything. I should have a team that's so good that they can tell me what to look out for. They can tell me what's around the corner. And I think those are the businesses that win. If you can surround yourself with a team, whether it's in-house, whether it's delegated to some outsourced vendor, whatever that may look like, I think the key there is as you grow, especially as you grow, and you have to keep a track of so many additional things, you should have a team in place that is able to tell you, here's what's around the corner, you don't need to worry about it, or here's what's around the corner, you should slow down, or you should speed up, whatever that may be. Yeah. So I think that's really good advice. Madison, thanks so much for coming on. If I I'm listening and some of these things are top of mind, what's a good way to get a hold of you?
Didn't I earlier say that you shouldn't go to Google to find people? I would say, my name, Madison Dini, you can find me either through my company's website or my firm's, Michelman Robinson. I'm on LinkedIn. But I do like kind of mentoring people through finding the right key resources, whether it's financial resources, legal resources. Obviously, I have a lot of connections there, and I love helping people and meeting new people in our space. So I'm always happy to chat.
Perfect. Well, thank you. Thank you so much for your time. This was a lot of fun. And thank you for listening to another episode of Skytale Insights.